This is part 2 on cueing pigeon pose. Oftentimes, teachers will cue parallel the front shin to the front of your mat. However, this could cause several problems, anatomical and biomechanical reasons, especially when it's given as a one-size-fits-all alignment. So here's why. 1. Knee joint stress, especially the meniscus and ligaments. When the front shin is forced into a parallel position, it increases external rotation and abduction of the hip. If the hip joint doesn't allow that full range, which many bodies don't, the torque often transfers to the knee joint, which is not designed to rotate. So as a result, there may be strain or injury to the medial meniscus, ligaments, or the lateral knee. Also, hip joint compression can happen when that is cued that way. Not every hip socket faces the same direction due to natural anatomical variations. I've seen that many times as a doula when I was supporting mamas with their labor and birth. So the differences in the pelvis and the femur happen, and then forcing a parallel shin can jam the femur into the hip socket. And this can lead to impingement or joint irritation. It can be especially risky for those with an impingement or any hip dysplasia. The third reason is pelvic imbalance and lower back tension. To get the shin parallel, students often collapse one side of the pelvis or torque the torso to fake the alignment. This throws off the neutrality of the spine and pelvis, potentially straining the SI joint or lower back. It can lead to discomfort or long-term instability of the lumbopelvic region. Fourth reason, it ignores individual bone structure. Not everyone's femur is shaped or orientated the same way. For many bodies, a parallel shin is not structurally possible without compromise elsewhere. The alignment should serve the function of the pose, not aesthetics. The fifth reason, it encourages forcing, not feeling. This cue often leads students to prioritize visual symmetry over internal awareness. In a pose designed to release and soften, this can cause the opposite, gripping, guarding, or checking out. I encourage a safer cue. Bring your front shin forward to a comfortable angle.